Zoom. Yay, whoever did it. Was that you, Kelly? Thank you, Kelly. So
Yes,
we
of
are
course.
recording this meeting. Everybody, thank you to our roundtable discussion. We're going to go ahead and do a quick round of introductions, and then we have one quick thing to share, answer any quick questions, and then I'm going to turn you over to Michelle Cornett with healthcare policy and financing. But before we do that, we'll go ahead and I know you all know me, but you get an introduction every meeting anyway. I am Becky. I am one of the two program managers for JBBS. I'll pass it over to Kelly.
Hi, everybody. Thanks for hopping on. I'm Kelly. I'm the other program manager for JBBS. And I would actually like to introduce and let him then introduce himself. This is Alex Clayton. He is our new hire here at JBBS. At the BHA on the criminal justice team, who's going to be working very heavily with JBBS. So, Alex, do you want to?
Yeah, thanks so much, Kelly. Yeah, so I'm Alex. I'm the JBBS and the criminal justice data team data coordinator. So I'm here to help kind of make sense of all the data, make sure all the program information gets in the right place so that we can get everybody's funding, flowing the way that we want it to. So this is only my 4th week, so I'm still kind of learning some stuff. But over the next month or two, I should be jumping in a lot more and a lot more active in some of these discussions. So nice to meet everyone.
And then Danielle, did you want to introduce yourself real quick?
Sure. I'm Danielle Culpin. I'm the Director of Criminal Justice Services and Statewide Programs Process. Nice to see everyone.
Awesome. Thank you, Danielle. Thank you, Alex. Welcome again, Alex, all the time. Super happy to have Alex. It does not look like we have anybody else here from the BHA, but just in case I'm missing somebody, anybody else here from BHA? All right, cool. Just wanted to make sure. So I'm going to be putting some information in the chat that hopefully this will come up for folks. Danielle, did you want to talk about this at all at this point, or what did you want to say about this guy that I'll be putting in the chat?
Yeah, so Becky's going to drop something in the chat. As you know, we finished our regular session for the 74th General Assembly of the Colorado Legislature on May 8th. And a lot of folks have just been reaching out asking about some House bills that could potentially impact criminal justice services. So we can take a deeper dive into that in the future, but I just at least wanted to share this document with you that just breaks it all down. It isn't specific to, and we can send that out by email if that's easier too. But
yeah, I think we're gonna have to, Danielle. It's not letting me copy and paste the link, so I'll go ahead and send it out to everybody via email.
Awesome, thanks, Becky. But yeah, it's just a list of all the bills, and you can access each of them individually to get more details related to the bills. It's quite lengthy, but just feel free to utilize that and save it as a resource, and we can definitely look into potentially tying in some of that those discussions into future meetings with you all. So just wanted to have the opportunity to share that. So thank you.
And like I said, it did not work in the chat. I was thinking that might be the case, but that's okay. Not a big deal. While Michelle is talking, I'll go ahead and shoot everybody on the invite an email with that attachment. So go ahead and feel free to check that out here in a few minutes once I get that out to you. So thank you, Danielle. Appreciate that. On that note, though, we did not have any other announcements other than if you have a contract that you have not signed yet, that you are doing a wet signature, please get on that. If you are having any delays on your end for a JBBS contract for fiscal year 25, please let us know. We need those in as soon as possible with signatures. If you are doing DocuSign, those will be released or are starting to be released on our end. So be on the lookout for DocuSign stuff, so we can get those signed and in place prior to July 1st. Any questions about that? Any questions about the contracting process? Anything we need from anybody at this point? Oh, awesome. Well, I will go ahead and push things over to Michelle Cornett. Michelle is with the with healthcare policy and financing. and she is here to discuss the 1115 waiver and what it might mean for you all. There was an announcement that came out a couple weeks ago about this waiver. We've discussed it in a couple of meetings, and I've discussed it individually with some counties myself. I'm sure Kelly has done the same. But we thought, what better way than to explain this process and what it might mean for you all than to actually bring somebody from HICPUF in. So Michelle, I will go ahead and pass it over to you.
Thanks, Becky. I am Michelle Cornett. I am a criminal justice policy advisor with HICPUF. I usually do this presentation in kind of a duo form with Hannah Hall, who is not available today, but her contact information is in the presentation. I think I shared that presentation with Becky as well, so she can share that info with you too. So don't feel like you have to take a bunch of notes. It will be provided for you. So yeah, I'm going to share my screen. Unfortunately, I can't see if you're like raising your hand when I do this. I only have the one screen. I know I'm old school here. So
we'll help you out, Michelle. If there are any questions or
thank
anything,
you.
we'll let you
I
know.
appreciate that. So here we go. Let me share. Now, can everybody see the presentation? Okay.
Yep.
Great. All right, so yeah, as Becky said, we are going to talk about the 1115 sub waiver amendment. So this was an amendment that, screen's pausing. Hello. There we go. Oh. Sorry, technical challenges. This waiver amendment is actually one that HICPUF already submitted to CMS. So this was, there are additional components that we submitted this round. So that's what I'll be talking about today. So what is a waiver? If, in case anybody's kind of curious what a waiver is really a way to exempt or waive certain requirements for that at the federal level are required for the Medicaid program to be administered. So states can waive portion, all of certain aspects of services or expand services to cover more people, to initiate a different type of benefit. You have to, when you do a waiver, you have to submit to CMS a 5-year plan. That is an agreement that you will be doing. And then you have an option at the end of that 5-year period to do a renewal. You can, if you have at the 5-year mark, you can amend. That's what Colorado decided to do with this particular round. So we had an existing SUD 1115 waiver that expanded services that we were currently providing to individuals that had a SUD diagnosis. And we decided to amend that portion. So we've added things to that original amendment that we submitted. So, this is kind of what I was talking about. The current Colorado SUD waiver really is covering just SUD and some of the IMD, the mental disease settings. And it went to January 2021 through December 2025. We submitted April 1st, 2024 to amend and add 4 key components to that waiver. So offering continuous eligibility coverage for children 0 to 3, also individuals that are incarcerated, so adults that are exiting any carceral setting will have continuous coverage, Medicaid coverage if enrolled for 12 months. And it also changed some of the requirements around the SMI, SMD component that we're adding. So we're expanding how long we'll cover or pay for services for individuals that are in like a residential treatment program. It was, I think, 15 days, and now they're extending it to, I want to say 30. What I'm really focusing in on is the criminal justice reentry services that we added to this waiver amendment. So that's the key piece here. So Historically, the inmate exclusion policy prohibited any kind of Medicaid coverage for individuals that were in a carceral setting. Right now, you can, individuals should be enrolled. They can be enrolled in Medicaid while they're incarcerated. So it doesn't matter if they're in jail, prison, in a youth detention center. They can apply and be determined eligible or not. They just go into what is called an incarcerated benefit status. So that's just something to bear in mind here. Some of the requirements for us to apply for this waiver, we are required for the reentry services to provide certain benefits. Those benefits meaning coverage up to 90 days prior to release that we're going to offer case management, MAT services, and the counseling. That does include the medications that are associated with that, and a 30-day supply of medications post-release. So all of the facilities that we're looking to cover right now in the original waiver amendment are just the DOC, so the state prisons and the youth detention centers. We are looking to add jails in the renewal period, which for just for kind of just so people get a perspective on the time frame or the date range here. We're looking to implement this waiver. So this initial part in prisons and the youth detention center, July 2025. And then we're looking to add jails in 2026. So just to kind of give you a perspective, it's going to take a little bit to kind of get all of this up and running. The goal really for all of this waiver work is to reduce recidivism. Obviously, we all probably are well aware of the health outcomes for individuals that are currently exiting carceral settings can be pretty dismal at times. So we're wanting to improve some of that, improve health outcomes, and really just improve community transitions. So the continuous coverage, just so everybody kind of understands that one, I've left this one in here because it does pertain to individuals that are incarcerated. So it's just really ensuring that individuals 12 months post exit have continuous coverage regardless of income. So if they get a job, it doesn't matter, regardless of any of those circumstances, barring that they pass away or they move to another state. They will have, in the state of Colorado, 12 continuous months of coverage. It's really wanting to promote long-term access and continuity with behavioral health services. That care coordination piece we all recognize is really important. It's also intended to combat some of those inequalities that we've seen, some of the disparities between, the racial inequity and some of the other disparities for individuals that are in carceral settings. And really improve some of those outcomes for those individuals. This is a little bit more on the continuous coverage. So again, without income, I'm kind of, this is a little redundant, but the eligibility, so they still do have to comply with some of the eligibility requirements that so recertification will come up at that 12-month mark. They are required to submit paperwork. It doesn't just auto re-enroll them into Medicaid. They do have to submit information. And at that time, at the end of the 12-month period, they would be determined either eligible or ineligible based on their individual circumstances. So they may be disenrolled at the end of that 12-month period. They also can voluntarily disenroll. Some people are, I don't want to be in this anymore. I have health insurance through another provider or what have you. And so they can opt out if they choose. So really, the House Bill 24-1045, the opioid and other substance use disorder study, is the proposed bill that's sitting on the governor's desk, I believe, waiting to be signed. This is going to provide the funding and support in order to really move this work forward with the 1115 waiver and the reentry services. We did submit our waiver amendment, the first one, for the reentry services on April 1st, 2024. CMS they did approve our submission. And then it goes to a federal public comment period, which ends at the end of May. And then once we do that, then there's a little bit of discussion back and forth with CMS, some negotiations around some of the components that we put in our amendment. And then there's the implementation part. So really, the implementation piece is what we're looking to kind of start incorporating stakeholder engagement and things like that. While the services for jails and carceral settings won't be actually going until 2025 or 2026, depending on what the setting is, we're really looking to have a robust implementation plan so everybody knows what to do, knows how to get people coordinated and how this in-reach work will happen. So here's some of the resources that are located on the HICPUF website. The Senate Bill 22-196 really was the sounding board. The legislation required that HICPUF evaluate whether or not they would like to see pre-release services. So a contractor was hired. We developed a report that was submitted to the legislature, which obviously recommended that we do submit a waiver for pre-release services. Here's again that proposed bill, the Senate Bill 24-1045, that is that legislation that will support that waiver work. There's also a sign up for our criminal justice updates, and if you want to be involved in just getting some of that information, it's really a way that we've created a collaborative. We've created a couple of things, websites with just, some FAQs and best practices to help support in case there's some questions. We get a lot of questions, and particularly like around status and things like that. So can people apply for benefits while they're incarcerated? Absolutely. All that information is located on the website. So feel free to check that out. And there's also a member handbook, which would provide some information around RAISE, some of the, provider information and things like that. That's supposed to be helpful for individuals. And then here's some of the stakeholder information, and, just the ACC 3.0, that program contract is in the RFP. So that, that information is available. And just any of the RAI MCO contact information is also available here. And this is our contact information. So if you have any other questions outside of this meeting and you're like, I wish I would have asked, here's our contact information for that. I am going to stop sharing. Any questions? I know that was a lot. So any questions? Things you just want to flesh out a little bit more?
Michelle, did you just want to reiterate to the group, sorry, when this is all going to take effect, or when this will have the most impact on the jails?
So for jails, we're not looking until 2026.
Okay.
At the earliest. So that date may change, and it may be a little bit further out just because of when our amendment would be approved by CMS. There's a period of time, it's a really tight window that you can submit a renewal component, which would we were going to add in the renewal. But CMS got bombarded with a lot of the reentry 1115 applications. So we got put in a queue, which is great that we're in there, but yeah, it may delay that. So at the earliest, it would be in 2026 for jails.
And there was a question in the chat, is that FY26 or calendar year 26?
It's probably going to be July 2026 at the earliest. Yeah.
Okay. Sounds good. Any other questions? Okay. Well, and as Michelle said, she put her and Hannah's contact information on the slide at the end there, and we have that as well. So definitely this is some stuff you all want to keep in mind as we're starting to move closer to these new rules, and just make sure everybody's aware of how this is going to impact you all and your clients. So Michelle, we appreciate you being here today and going over this with everybody. So
Yeah,
thank you.
absolutely. Thank you. Have a great day, everybody.
You too. Thank
Bye.
you.
Thanks, Michelle.
All right. So Michelle was our only speaker that we had lined up today. So unless anybody had any other business they wanted to discuss or had any questions for us, we are going to be able to let you go early today. So that being said, I believe our next meeting is probably a learning community.
Yeah, it's actually going to be the GAIN training. So
Oh, that's right.
yeah, our next meeting was going to be a learning community on June 19th. June 19th is a state holiday. So we moved that to June 12th. And that is now the GAIN training for your folks that are going to be doing the GAIN 3.2. Instead of that meeting being from 2 to 3 o'clock like it normally would be, it's going to be from 1 p.m. to 3 p.m. And if folks can't attend, it will be recorded. It will be posted to our website. And we should have another training lined up for sometime in July, if folks can't attend those. So we're working on that July training. I think I've got a hold right now tentatively for July 10th. We'll kind of see how that plays out. That's why it's tentative, and we'll go from there. But go ahead, Kelly.
I was just going to say, just to please get the word out to your teams that we really do need strong attendance at this training, because this is something that we are going to be doing moving forward with our new contracts. And once we're in it, we're in it. So we do want to encourage you to please make sure your teams are in attendance for that GAIN training. So. All right, seeing no other comments in the chat, we want to thank you all for joining us today, and we will see you at the GAIN training. Looking forward to it. Thank you all.
Thanks, everybody.